Okay, folks, welcome back. This is Chapter 18 of your Basic Machine Operator course, Radiography of the Pediatric and Geriatric Patient. This ought to be quite interesting. We do have to do x-rays, both pediatrics and geriatrics. I actually love this lecture. This is kind of fun to do. If you've ever had to do a grumpy old man or a pissed off child on an x-ray, it's quite challenging. So let's talk about it a bit. All right, so our objectives demonstrate the appropriate levels of communication with children of any age. We're going to talk about immobilization of infants and toddlers for radiographic examination. And we're going to compare some of the characteristics of the developing skeleton versus the mature skeleton. We're also going to formulate exposures for pediatric radiographic techniques. We're going to talk about that and show you how to do those formulas. Identify pediatric radiographic examinations that vary in method from adults. List and describe 3 pathological conditions common for pediatric patients. List considerations that improve communication and compliance when dealing with older patients. And also, we're going to describe changes that occur in the skeleton and soft tissues as a result of aging, and also how to expose appropriately for patients with osteoporosis and or advanced age, and then also list the signs that suggest the possibility of non-accidental trauma in children and in geriatric patients. So, children, woohoo, score. Quite interesting doing this. Providing furniture that's child size in your waiting rooms or, anywhere that you're going to be prepping them, helps a lot. Offer books, games, toys, occupy children during the waiting period, and then give children rewards such as stickers. They always love stickers. Stickers are cool, so having a variety of those things are very important. I like little Play-Doh figures. They used to make little Play-Doh figures and that kind of stuff, and anything that I could pick up from the dollar store that would serve as a reward. I never give gum or anything to eat because that's inappropriate, but something that they can take home with them that doesn't break the bank, kind of thing. Infants. If they don't throw up on you, you're going to be lucky. So, infants, they feel secure when they're warm and snug. They like to be held firmly, but yet gently at the same time. They relate to faces, specifically their parents, their caregiver, like that. So it helps out a lot. If they have somebody that they know within the room itself, and don't forget you're going to have to shield that person as well as shielding the infant gonads as well. Like eye contact, but cannot focus very well, and they do respond to soft forces. Again, if they don't throw up on you, you're lucky. Toddlers, woo, man, they can be grumpy, absolutely grumpy. They're still developing their social skills. They like to hold on to something familiar as well. They're more comfortable at interacting at an eye level. They like eye contact. They respond to comforting and that kind of thing and holding, but, has to be gentle in nature. They don't like anything rough. So they can definitely be a handful. All right, so communicating with young children. Involve the child by offering valid choices. Give them choices, especially if they're an age that they can understand better. Answer questions simply and honestly. Praise the child for cooperative behavior. Give toys at the end. Show them what you have. Just say, listen, if you're good and we can get through this and you do exactly what I tell you to do or what I ask you to do, you'll get this at the end. And that gives them some incentive, but it's only going to be short term. It's not going to last that long, so take advantage of it while you can. All right, so communicating with older children and adolescents. Older children, they have a better understanding of their surroundings and circumstances. They respond to humor. They're willing to help, and they appreciate valid choices and honest praise. Adolescents, they behave similar to adults. They may have short attention spans. They want to play with their phones and that kind of stuff. So, work with them as quickly as possible to get the x-ray done and get them back to their social media. They may have an exaggerated sense of modesty, but, you have to do what you have to do. Remember, one of the things about modesty, brings us back to children, especially of this age group. Older children and adolescents, you need to really the best you can to have same sex, doing the x-ray. It's just very, very difficult for, young women to be with men during the x-ray process. And if it's an absolute must do, you need to have mom in there with you. period, either way, male or female. So make sure to keep that in mind. All right, so mobilization. Use mobilization devices to avoid having someone hold the child during exposure. Things that they can hand on to. I mean, this particular deal right here is he's in the radiograph and he is holding. Notice that the IR is on the chest. This is a lateral chest, and he's helping to hold this young man's hands up. That's okay. Do the best you can with it. This is probably a dad or something, which is appropriate. Notice that he has his radiographic protective gloves and also a shield for his gonads and chest. The child must be held, have non-occupationally exposed person hold the child, and provide appropriate protective apparel, period. So mobilization devices, compression bands, frames, boards, Velcro straps, clamps, and sheets. Oh my God, let's close this. Look at this poor child. Oh my God, that is so cruel. Please don't do this. Please have mom come in there and hold. Do the best you can. Now, if you get a little kid like this that seems to be happy and compliant, why do you even have him strapped down? If he's going to be compliant to be in this papoose, which is what this is, then he's going to be compliant enough to lay on an x-ray table. But, oh my Lord, this looks, oof, man, poor little dude. He's got his binky, looks like he's doing pretty well, but scary kind of stuff. He's all strapped down. Most kids do not allow that. Notice also that we have a shield protection here for gonads. I don't know what x-ray that they're doing, but oh, this looks very extreme. All right, here's an interesting one. Oh my God, the Pigiostat. I've never used one of these. Scary stuff. It's like a tube. I mean, this is not even a real baby. They stuck him down in there into the tube like this. This just looks awful. Can you imagine having a child in there? They would cry their little hearts out. Your mom's probably going to hit you, or their mom's probably going to hit you in the head with a frying pan or an IR. He's going to pick it up, a cassette tray, going to whack you with it. Anyhow, this is just a horrible looking thing. But Pigiostat. And if by chance you did, get this child through this event, I'm sure they're not going to be happy, and they're going to do something quite funny when you pull them out. Let's take a look. Oh yeah, gonna give you the finger. Yeah, yeah, I'm sure they're not going to be very, very happy. All right, moving along. All right, so some mobilization devices that you can consider that are a little bit less intrusive. Band-aids. Tape. With a little 4x4, 2x2, that kind of thing. Foam blocks. Anything, a toy. Anything that you can do that keeps things on a lighter matter and it doesn't anger the parents because you're strapping their kid down is always going to be help. Stockinette, sponges, tape, those kind of things. All right, mummy wrap to immobilize infants and toddlers. This is pretty extreme. Again, if you can avoid this, do so, but this is how you wrap up a kid. I'm not going to go through explaining this procedure. Hopefully you never have to do this because it can be very trying. I mean, just the restraining of an infant, they don't like that. They really don't find that secure. They don't find that pleasant. So more than likely they're going to be squirming and crying anyway. But immobilizing infants and toddlers with some kind of blanket device is something you can do if necessary. I'd be consulting the practitioner with that. All right, so pediatric radiography. Using shielding is very, very important. Select the IR appropriate for the size of the patient and or body part. Determine a comparison or a bilateral study, see if that's needed. And also use a grid only when the part is greater than 12 centimeters in thickness. Okay, so you're using grids for greater than 12 centimeters. All right, so pediatric anatomy, head is larger in proportion to the body size. Spinal curvature is different depending on age. Skull and other bony areas are not fully ossified. They don't have tons of calcium, so they're a lot towards cartilage, especially in the infants. So they get green stick fractures if they do get fractures, and they usually don't get fractures because they are so pliable. Bones are less dense and more easily penetrated by radiation. Right, so formulating pediatric exposure techniques. Use pediatric technique chart when available. If a pediatric chart is not available, compare part size to a part of similar size on an adult. And then modify technique chart factors for small adult by decreasing 2 kVps for each centimeter difference in measurement and using 80% of the suggested milliamps. Very easy, formula, not that difficult. We have such great computers these days. Your computer image generator is going to be telling you, your settings that you're going to have to use anyway. You should have pediatric settings based on kilogram weight, so you should already know that before they ever get into the X-ray department, because they're going to be, the chart's going to come with them. They're already going to be weighed and measured at that point. All right, so pediatric pathology, swallowed or foreign objects. Here we go. Looks like about a quarter. Yeah, it's in the intestine somewhere. We also are looking for green stick fractures, slip epiphysis. Epiphysis are the official plates, are the growth plates, most commonly found on tops of bones. Endocrine system malfunctions, and also non-accidental trauma. All right, so geriatric patients, older people, older adults, they're usually mentally alert. They may have reduced hearing and visual acuity. They may move slowly and have limited flexibility, so you need to be, give them time. I love old people. They are such wonderful storytellers. My problem is that I'll sit there and get talking with them, and I'll just kind of lose myself and just sit there and talk and talk and talk, and oh my God, it's been 45 minutes, and I haven't even taken the X-ray yet. Appreciate being treated with respect. They're good folks. For the most part, you don't find very many grumpy folks when you bring them through. The thing that saddens me the most is that usually when they're in our department, they're in a lot of pain. So whenever I, have somebody that's fractured something, especially the elderly folks, I try to make sure that we have pain management that's in place prior to them coming into the X-ray department. All right, so communication with patients who have hearing loss, gain the patient's attention for speaking, okay? Face the patient directly. Don't yell. Don't be loud. I mean, not everybody, that's elderly can't hear, so don't think that. For patients with hearing loss, speak in a lower tone and a louder volume, but don't shout. Keep your background noises at a minimum. Open-ended questions are really good. Validate understanding by asking the patient to repeat the instructions. Be patient and rephrase instructions anytime that they need it. Repeat it if they need it. I mean, it's very, very important to take your time with these folks. All right, so physical effects of aging. There's a decreased calcification content resulting in porous, radiolucent type of bones. Obviously, we have atrophy of muscle tissue and a loss of skin elasticity and subcutaneous fat, and their veins become very, very fragile. Right, so radiography specific for geriatrics. Allow the patients to wear eyeglasses if possible. Give them instructions prior to having the patients remove hearing aids. Use table pads. Very, very important to support. Like you see here, we have a nice round sponge that you can slide right up underneath the coccyx so it won't be so hard on them. Remember, that table is a hard, cold surface. So anything you can do to make them more comfortable is very, very important. Use positive and firm but gentle touch when positioning to avoid injury. Formulating geriatric exposure techniques. More than 70 years of age, decrease your kilovoltage, okay, by 4 to 6 kVps. More than 80 years of age, okay, kilovoltage may need to reduce all the way up to 10 kVps. So remember that. That's a nice rule of thumb that you need to post somewhere in your station so that you got that. All right, so geriatric pathology stuff we're looking for: osteoarthritis, heart disease, osteopenia, diverticulosis, Parkinson's, Alzheimer's, and decubitus ulcers. These are different things pathology-wise that the clinician may be looking for. In summary, in this chapter, we use child-sized furniture, toys, and rewards. Dollar General, man, or I like the Dollar Tree, because the Dollar Tree, everything's really $1. So anyhow, for patients of all ages, use positive touch, make eye contact, and communicate with them respectfully. Use immobilization devices to restrain. Good luck. Never hold the patient during exposure. Somebody else is going to have to do it. Make sure to protect them. All right, so if a patient must be held, have a non-occupational worker hold the patient and provide appropriate protective apparel. When taking radiographs of children, use shielding, select the IR appropriate to the size of the patient and or body part, and only use grids when the part is greater than 12 centimeter in thickness. Do remember that. You will see that on a test. So use a grid only when the part is greater than 12 centimeters in thickness. Pediatric skeleton, large head, proportional to body size, spinal curvatures that are absent or less pronounced. Pediatric technique chart is not available. Modify the technique chart factors for small adults by decreasing 2 kVps per centimeter difference or using 80% of the suggested amount. Keep the exposure time short, period. Keep them short. You don't want to overexpose. Pediatric pathological conditions include swallowed or aspirated foreign body objects, green stick fractures, remember we talked about that. Any epiphyseal plate type of problems is what we're looking for, some endocrine malfunctions, and non-accidental trauma. Geriatric patients may have limited movement, flexibility, and sensibility, so keep that in mind. Also keep in mind the things that happen with the aging, okay, all this stuff, and remember that we can cause, tissue damage problems, muscle problems, because we're just not paying attention, okay? Be careful. Taking radiographs on a geriatric patients, allow them to wear their eyeglasses, hearing aids if possible. Use table sponge and pads. Depending on age, decrease kilovolt voltage by 4 to 10 kVp for geriatrics. And also geriatric pathological conditions, the stuff we're looking for. Keep that in mind. Oh, Walter. Speaking of grumpy old men. All right, well, thank you very much for this one. I hope you enjoyed it as much as I did. If you got questions, student@emeds.net or student@Metzi Institute. We'll see you later. Have a good one, guys.